takeaway of our article is that there has been a 2.5% per annum decline in death due to mitral regurgitation, a very common valvular heart disease we see in our patients. There has been an overall 35% decline in the last 20 years. However, in the last 5 years, we are seeing an increase in mortality due to mitral regurgitation at nearly 1.5% per annum. Hi, my name is Vibhu Parcha. I am a clinical research fellow in the Division of Cardiovascular Disease at University of Alabama at Birmingham. I'm the first author of the new article which is coming out in Mayo Clinic Proceedings entitled Mortality due to Mitral Regurgitation among Adults in the United States from 1999 through 2018. We were interested in analyzing what has been the mortality patterns for mitral regurgitation, a common valvular heart disease, in the last 20 years, that is from 1999 through 2018. To achieve this objective, we analyzed the CDC Wonder Mortality Database, which captures the mortality of all American adults in the last 20 years, and we evaluated this data set and found that there's been a decline of nearly 2.5% per annum in deaths due to mitral regurgitation in last 20 years. Notably, we had an increased decline in mortality due to MR or mitral regurgitation till 2012. But since 2012, we have seen an inflection for increase in mortality due to mitral regurgitation at nearly 1.5% per annum increase, which is quite worrying. This change in the mortality pattern was consistent across the subgroups of age, sex, race, urbanization status, which makes this finding very rigorous and at the same time encourages us to look into what are the determinants of this change in mortality pattern in the United States. This study has very high clinical implications since mitral regurgitation has a prevalence of nearly 2 to 10% among individuals more than 75 years of age, and is associated with nearly twofold higher mortality compared to their counterparts who do not have mitral regurgitation. Given the high prevalence of this medical condition, it is important for us to summarize what's the mortality pattern of this valvular heart disease, and given the improvements in the therapeutic approaches, the medical options, the invasive options for managing patients of mitral regurgitation, we have seen while the overall trend seems to be looking good, there are important subgroup differences such as that in sex and race which need to be looked into more carefully, which encourages us to look into the determinants of these differences, especially when we have so many medical options available for treating these patients who did not earlier have a lot of therapeutic options available. This study has very high clinical implications since mitral regurgitation has a prevalence of nearly 2 to 10% among individuals more than 75 years of age, and is associated with nearly twofold higher mortality compared to their counterparts who do not have mitral regurgitation. Given the high prevalence of this medical condition, it is important for us to summarize what's the mortality pattern of this valvular heart disease.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.